Hi, welcome to today's Next Gen Tips and Tricks BMI Health Promotion Plan. What is BMI Health Promotion Plan? BMI Health Promotion Plan is a screening template used to measure patients who are underweight, overweight, or obese. Percentage of patients ages 18 years and older with BMI documented during the most recent visit or within the previous 12 months to that visit, and when the BMI is outside of normal parameters, a follow-up plan must be documented during the visit or during the previous 12 months of that visit. Why do we need to document it? Health centers that receive federal award funds, quote unquote awardees, under the health center program must report this data annually through the UDS reporting system. The UDS is a standard data set that is reported annually and provides consistent information about health centers. This core set of information includes patient demographics, services provided, clinical processes, and health outcomes, patients' use of services, costs, and revenues. It is a source of unduplicated data for the entire scope of services included in the grant or designation for the reporting year. If the health center brings services or sites into the scope during the calendar year, data must be included for the full year, not just for the period after the date of the scope change. Here is a UDS reporting resource link for further information. Where to access the BMI Health Promotion Plan template. While in the Intake tab, the MA nurse will scroll down to the Vital Signs panel and click Add to open the Vital Signs template. Once the Vital Signs template opens, click the BMI plan link to open the BMI Health Promotion Plan template. This is a suggested workflow practice for all MAs, nursing, and providers. Where to access the BMI Health Promotion Plan template continued. Note for MAs, nursing, and providers, clicking the Health Promotion Plan link will open the template, but will not auto-populate BMI diagnosis, diet, or physical activity. You will need to select the diagnosis, diet, physical activity manually using this workflow by clicking the associated blank fields outlined in red. Again, please note the suggested workflow practice is to access the BMI plan template through the Vital Signs template after adding the weight and height measurements. How to document the BMI Health Promotion Plan. First, you want to input the patient's weight and height measurements into the Vital Signs template. Then click the BMI plan link. This workflow will auto-populate BMI diagnosis, diet, and physical activity. You can change the diet and physical activity selections if needed. You can also document further details in the free text space underneath the details. Underneath in details. How to document the BMI Health Promotion Plan continued. So once you have made your selections for BMI diagnosis, diet, physical activity, and referrals if needed, you're going to want to click Add. The BMI plan has now been added to the order grid below. Now you can go ahead and click OK. Just a note, the BMI diagnosis and instructions will carry over into your assessment and plan in SOAP. So you'll be able to see the diagnosis and your plan orders with that instruction. Another note, if the referral is completed during the BMI Health Promotion Plan documentation, the referral will still need to be generated by the provider for the coordinator in the checkout tab. So normally how you would generate that referral document by clicking the referral document button. It's the same thing here. So you need to go to the checkout tab and generate that referral. Updating the BMI health promotion plan instructions. So in the BMI plan template, you want to select the completed BMI instruction from the completed grid at the bottom. Then click on the instruction field pick list box you want to update into here. Next, you want to select the replacement, then click OK. So you select your replacement instruction, then click OK. Now, click Update to save changes, and then you're going to want to click OK again. Any questions? Well, I want to thank you for joining me in today's Next Gen Tips and Tricks BMI Health Promotion Plan. We'll see you soon.